The state is now requiring Florida healthcare facilities to report medical workers and first responders who test positive for the COVID-19 virus. This new mandate follows a Contact 5 investigation that found Florida, like most states, was not tracking what some experts call key data in stopping the virus to spreading. Katie LaGrone explained.
The Sunshine State issuing new rules to better track COVID-19 among certain people deemed high risk. According to these documents obtained by the Contact 5 investigators, just one day after we were first to discover the state wasn't tracking healthcare workers and first responders who tested positive for the virus, Florida's health department now mandating all healthcare providers and facilities must immediately report all COVID-19 cases involving medical workers and public safety employees, including law enforcement and firefighters.
It really is astonishing that we haven't asked this question a long time ago.
Last week, Martin Peeble, a registered Florida nurse and union representative, spoke out over concerns hospitals were not properly protecting employees working the front lines. Cases involving medical workers with the virus is key data, he says, to stopping its spread.
It'd be pretty obvious. How are you going to manage something if you're not tracking it?
Head of the state's Nurses Association also supports the new mandates.
We definitely need to know the impact on healthcare workers. It speaks directly to the need for personal protective equipment and the importance of having that available to healthcare workers.
Florida joins several other states, including Ohio and Minnesota, that are now tracking healthcare workers infected with the virus. While it's too soon to know just how many of the more than 13,000 positive cases reported in the state are healthcare workers, with the virus not expected to peak here for another month, the new rules aim to zero in on populations most vulnerable. That is, if it's not already too late.
We need to know exactly what the risk is for healthcare workers, and knowing what the numbers are, even starting today, would be helpful.
According to these new requirements, the state will also start tracking people who live or work in long-term care facilities, which includes senior centers and prisons. Katie LaGrone, WPTV News, Channel 5.
And as Katie just mentioned, according to those new mandates, the state will track those people working in long-term care facilities.